Hi, my name is Sam Kippen and my student number is T00698764. I'm here with my clinical mentor, Dr. Jones, today, and our patient Hunter. Hunter is going to be getting a dental COHAT today, and I'm going to be starting with doing an extraoral exam. So I'm just going to start by feeling his TMJ, and I'm going to start by feeling his ramus, and I'm just going to feel for any abnormalities in there. Then I'm going to see if I can feel any enlarged lymph nodes. I can feel his lymph nodes here, but they both seem to be the same size, so that is great. And then I can just start to have a little bit of a look here. We can note here too that we do have a missing incisor here, so I will chart that. And I'm just taking a little bit more of a look. We'll get a better look once we're intubating him. But we can see here too that he does have a pretty good bite. There doesn't seem to be any underbite or anything wrong with the bite itself. Okay, so that is good. So we're just gonna need to chart that. So this will be Hunter's right side. And this is going to be his 101. Okay. I'm going to go over here and I can start filling out the patient chart. My owner is me. The patient is Hunter. Breed, he is a golden retriever mix, not a purebred. He's 9 years old. The date today is Feb 23rd. 2024. And then I'll put the dental history in there too. 1 COHAT 1 year ago extraction of 101. Brushes once a week, brushing, and then head shape, I will note that here as well. And then here I'm just going to take a look, and we have his maxilla, and this is the tooth that is missing here. It is going to be the 101, and then we know that there was a previous extraction there. Okay. So I'm going to start by charting the 100. I'm going to be doing the buccal surface first. So I'm going to start by probing. I'm going to be looking for a 3mm sulcus or bigger, and I'm just going to go around and see if I've got any spaces that are larger than 3mm. That's close, but it's not quite. And I'm also canning the teeth as I go here. And that was the 106. I got my clipboard there. I'll grab that in a second. I'm just gonna change my angle a little bit so I'm able to see more back here. And now I am getting a little bit of bleeding on the gums here. The amount of bleeding I'm getting here I would not consider to be normal, so I'm going to need to mark that down in a moment, but I'm going to continue doing the rest of this quadrant first. So this is his 108 buccal surface. So the 108 buccal surface, so I'm going to mark that here. This is his right here. I'm going to write gingivitis, and then I'm going to write grade 2, and then I'm going to write here that this is his buccal surface. I'm just indicating that right there. Okay. Just gonna put that behind me. Okay, so now that I've counted all of his teeth there, now I just need to use the Explorer, and I'm just gonna see if I'm getting anything that catches. Still resting my hand down. Just gonna move this way a little bit. Now, I've got some calculus here. So this is the first large amount of calculus that I've seen. And I can see that it's getting stuck. It gets stuck on my Explorer there. So that I'm gonna have to note. So this is gonna be the 104, 105, 106, 107. So I'm gonna take this and I'm going to mark the 107. And so I'm gonna say
It's light.
yeah, so I'm gonna write moderate calculus on the 107. So I'm gonna write moderate calculus. I'm gonna show which direction that's going to. So that's going right there. Can I hand this back to you? I need to make sure I'm getting my modified pen grip correctly. So we've got, again here, this is an issue. So I'm gonna set this down, and that's gonna be as 108, and it's also going to be moderate. So this is gonna be moderate calculus. And then looking back here again. And I'm gonna write the same on the 109. And then the gingivitis I'm going to be marking here. So I'm going to be writing basically all across. I'm doing a whole quadrant here. I'm going to say grade 2. So I'm going to write down here. I'm going to write 2. It's all the way from his 104 to his 110. Grade 2 gingivitis. We're noticing the bleeding and some inflammation there. So that's great. Okay, we can pause the video there. So I'm just scraping the 201. I made a mistake. I should be actually probing first. So I'm taking my probe on my buccal surface of my 201.
Just with your head's turning off.
And then same thing here. Okay, so we found a spot that we're going to need to mark. So we have a 3 millimeter okay. So we've got here, we've got
It's on the buccal surface, right?
yeah. So I'm using the wrong end here. And I'm counting the teeth again as we go.
There you go. Yep.
Checking for periodontal pockets here as well. notice anything back there that is of concern. So
It's quite common that the teeth are cleaner on the inside surface than on the buccal surface rather than the lingual surface. Or sorry, on the lingual surface more than the buccal surface. That's quite common that they're cleaner. Less buildup.
I'm not noticing a lot of calculus or plaque. Nothing to really note here.
Yeah, that sounds reasonable.
So I'm going to be doing his 100 surface here now. Quadrant, I should say. Again, working in a coronal direction. I'm going to clean that with the curette in a second just because it's right at the gum line. So I'm just working coronally right now with my scaler. Now I should be able to get in here with my scaler and remove some of this. And I can use the tip of it to get into the difficult areas there. So that should be able to take some of that off. I need to be resting my hand down there as I'm doing this, but see how that's starting to come off there now?
Yeah, that looks good.
Yeah. And then I'll move over to the next one here.
You got some staining on these teeth that may not come off. It's not. When it's inside the enamel, you can't go further than that. So.
Right. And then I'm just gonna readjust myself here. So I've got some here that I should be able to get a little bit better. If I can't get this too much right now with my ultrasonic scaler, what I'll do is I'll take my hand scaler and go at that. And then on the 109. Still working coronally as I go around. I'm just going to come back here a little bit and go back over. Now I can't actually get under the gingival with this, but I will be using in a second here my curette. So I'm going to take my scaler first, and I'll do my hand scaling. So I'm going to start with my 201. And I just have to make sure that I'm resting my arm on something, and I lay this down and then I grip. Laying it down and then gripping, working coronally. Same thing here. In a moment we'll go underneath that with a curette, and we'll get some more of that off at that point. More of that calculus. So again, trying to pull and grip. Trying to use a blade to take off all of this calculus as much as possible. Just come back to this one. See? There we go. There we go. See how I chipped that off? That's what I was really going for there. It's got that large piece off, which is great. Okay, so now it's time to do some curettage. So I'm going to put this aside here, and I will pick up my curette, and I can use my regular curette and then my greasy next. So,
okay, we'll go quicker here because I'm straight 7.3. I'm starting to get a little close.
okay. Just inserting it and then pulling. And then we'll be able to clean up a little bit of this here too by inserting under the gingival line and then pulling. Get some of that debridement out from the subgingival area. Turning and then pulling. Inserting into my carnasal periodontal pocket and then pulling. Same thing here. And there's not much of a pocket there, so I want to make sure that I'm not doing anything that's going to cause damage to that gum line. Something there. Run it down. In and then run down, run in, run down. Okay, and now we need to use our greasy. Make the same thing here. In and down, in and then down. We'll use a little bit of water here, remove a lot of that, and we'll be able to see better too when we're doing our curettage here. Down, insert, rotate down, rotate down. Same thing here. Inserting into your periodontal pocket, running down. So 109, same deal. And then note 10. So now I'm just gonna clean a little bit of water here. Get rid of some of the blood. Good, so now we're gonna do a little polish and we should be all done with his teeth there, so. I'm gonna put the scanner back in and grab this, put this back in between my fingers there. Grabbing a little bit of propy paste and I will lay it down. I don't have a 101, so I'll start on a 102. Again, working coronally, no more than 10 seconds per tooth. Okay, so I've cleaned his teeth there now, so now I'm just gonna use a little bit of the water here.
Yeah, we just use water mostly.
That's looking a lot cleaner there now. It's not perfect, but he's 9 years old, so some of this we're not going to be actually able to get off, but it is a lot better than what it was before. Alright, there we go. Okay, so I'm just going to start by scaling these teeth here. I'm working coronally. And I'm just going to use the tip of my feeler to get into this little pocket here on his 109, with 209.
Sorry, can I just get in and
Yeah.
can you get a show better what you're doing there?
Yeah, so I'm just working on this little
There we
pocket
go.
here.
Okay, that's better.
On
Thank
his
you.
209, can you see that?
Yeah.
Okay. Just trying to chip away at that. And then just doing the 210 there. So 209, 210. Okay, so now we have scaled all of the 200 arcade and the buccal surface. So I'm going to put this back here, and I'm going to grab a hand scaler. So with the hand scaler here, again, I'm going to work coronally, and I'm just going to make sure that I am resting my hand down and grabbing and pulling down, working coronally. Trying not to do more than 10 strokes on any tooth. Okay, and now I'm going to need to grab a curette. So I'm going to take my curette and I'm going to come in and down and in and down. I'm really try and get in and under this canine here. See how I'm getting under and I've got the blade flat and then coming down, trying to scrape. So I'm trying to clean here. Look at all that coming out of there. So the benefit of the curette is if you put it under here and then use the edge, you should be able to clean subgingivally. Getting it into the periodontal pocket and then scraping down. I'm trying to get all that gunk out. There we go. And then keep going here. And I'm using the water and I'm spraying it in this direction here, rostrally. because I don't want it to go into the back of the throat. But I'm trying to clean up the blood that I've got there. Just spraying down a little bit on my curette here. So we were on this canine, and that canine seems good now. Trying to get up and under as much as I can without causing damage to the gum line. I'll be able to turn this light down a little bit here. Can go. I'm just trying to get into that periodontal pocket as much as I can. And then pulling and scraping down. Inserting. And then pulling and scraping. I got my hand resting here on his jaw. So that way I can't slip and cut. And then the same thing here going, this is a large tooth, so it's gonna have a large root. So same thing, inserting my curette and grabbing and going down in small motions. And when I'm saying down, I mean working coronally. Okay, so now we're gonna need to give this a little bit of a spray down again. Okay, so I'm just getting a little bit of prophy paste on my polisher here, and I'm gonna start here again at the 201. I'm gonna wait until I'm on the tooth, and then I'm gonna press down lightly on the pedal. And I'm just gonna work my way around. Hunter's teeth aren't that dirty, so we don't need to spend too much time, but we don't want to miss his teeth, doing any of these teeth either. Doing a little bit more prophy paste, going on the tooth, and that came off, so I'm just gonna put it on the tooth. There we go, like this. Resting my hand down here. Okay, so now we have that side all done. So I'm just gonna put this here and put this here, and then take some water, have a little rinse. I'm just gonna lift the lip here, like this. Lifting his lip, letting that water come out. Okay, and then we're done that side. How did that